Hello, I'm Dr. Ben Gilbert. I'm an ophthalmologist here at Chico Eye Center. I do eye surgery and the medical treatment of the eyes. Cataracts are a clouding of the lens as we age mostly. Sometimes they occur earlier with trauma or other eye problems, but for most people it's just an aging of the lens that first stiffens and then it gently over time becomes cloudy. And as it becomes cloudy, we have to turn to surgery. Sometimes we can correct it with glasses before surgery, but eventually if it gets too cloudy and causes glare and other symptoms, then we do surgery. And the surgery for cataract is very straightforward. We do that usually at our outpatient surgery center and done through a small incision, almost overnight healing, and quickly recovers. So with the cloudy lens, then we do surgery, we actually remove the cloudy lens and put in an intraocular lens that clears that up. When we do cataract surgery, we can at the same time correct refractive errors of the eyes, nearsightedness, farsightedness, astigmatism. And we do that with special lenses. Lenses that correct astigmatism are called toric lenses. We can correct both distance and near vision with multifocal lenses. The standard lens that we put in is a monofocal that gives good distant vision, and then you use reading glasses. But specialty lenses can actually do a better job of that, giving both distance and near vision. We also offer laser-assisted cataract surgery, which is a different approach to removing the cataract, but it provides a little bit more precision and a little more reproducibility. Another type of lens that we use in the eye is called the light adjustable lens, the LAL, and this lens allows us to put the lens into the eye and then over time adjust the refractive error so that we can give you a sort of blended vision with both distance and near, and pretty much eliminate almost all the refractive error of the eye. We also offer laser vision correction that allows us to correct the refractive error of the eye in young patients. And this allows us to eliminate nearsightedness, farsightedness, and astigmatism. And we do this by reshaping the cornea with a laser. LASIK and PRK is the terms that we use for refractive surgery, where we alter the shape of the cornea to correct refractive error and eliminate glasses. The surgery that we do is done in different ways. One way is to create a flap on the eye, and that's called LASIK surgery. We lift a flap and then do the treatment on the inside layer of the cornea. Another approach that we use sometimes is a surface ablation called PRK, and that's where we remove the surface cells and then do the treatment directly on the more superficial layers of the cornea to eliminate the refractive error. And both techniques are very successful. Many patients enjoy glasses-free vision for the long term after LASIK or PRK surgery and are very happy with the distance correction. In the course of the evaluation for LASIK or PRK surgery, we do a complete exam of the eye with corneal mapping and thickness measurements. And then through those tests, we determine which procedure would be the best one, whether LASIK to make a flap or PRK, the surface ablation procedure. As we age, the lens of our eye becomes stiff and less flexible, and it makes it difficult for us to focus from distance to near. And as those changes occur, we can correct some of that with intraocular surgery. And one technique is to do a refractive lens exchange, where we remove the lens and replace it with a multifocal lens. Our goal with refractive lens exchange is to improve your day-to-day life by eliminating your need for glasses, both reading glasses and distance glasses.